Well, hello to our wonderful listeners and viewers. I am Dr. Vladimir Bariev, autism specialist, and I am the host of Autism Demystified. And we have a very special and wonderful guest here with us today. I am going to read her bio right now to let you all know about exactly why she is so wonderful and joining us today on Autism Demystified. So, Dr. Eva Cesnek, aka Dr. Evka, is a DPC physician who practices direct primary care in central New Jersey, offering office visits and house calls. He's a multifaceted, holistically trained family medicine physician with almost 2 decades of clinical experience, various best selling books, has shifted healthcare paradigms, and is dedicated to providing personalized, accessible care at all stages of life. Dr. Evka, thank you so much for joining us here today.
Oh yeah. Oh yeah. Dr. Vladimir is here. I'm gonna have such a good conversation. Looking forward to it.
Absolutely. Now, Dr. Evka, the first thing that I wanted to ask you actually was you and I met over discussing the subject of the autism spectrum. Can you share with the audience your experiences with the autism spectrum, the families that you have seen, and how your work has been impacted by that?
Oh gosh. Whew. So welcome to New Jersey, right? Welcome to this area where we're living, where the rate of autism spectrum disorders is on the rise, partially due to increased detection, partially due to people having children at an older age, partially due to environmental factors, and I think also increased awareness. And we are seeing children around us who have autism, and the signs of autism can be picked up early. They don't necessarily have to wait for somebody to think that you have autism when a child is 4 or 5 or 6. Some of the earlier signs can show up as early as infancy or late infancy, and not just in babies who have gross developmental delays, but in babies who also are going to be much more likely to be diagnosed later in life with high functioning autism. And I've actually written a book about it, or books. One of those books is the Colic Handbook. So I read, gosh, hundreds of research articles about colic. Colic is that medical condition where babies just cry and cry and cry and cry for over 3 hours a day, over 3 days a week, for over 3 weeks, but usually it's a lot more. They sound like they're in pain. It's not your regular cry. Some of those babies don't stop crying when they're 2 or 3 months old. They continue to cry a lot. It's a little different. What's causing it? Babies who continue to cry and exhibit signs of colic when they're close to 6, 7, 8 months old have a higher percentage chance of later in life being diagnosed with either a learning disability, ADD, ADHD, or an autism spectrum disorder. Another sign is that's sometimes overlooked in children is children who have significant feeding challenges, who just as babies even have difficulty feeding. It's a struggle for the family, and there's no good explanation for it. It's just happening, and what's causing that? Um, Medicine diagnoses are not always present. And sometimes the diagnosis that emerges later in life of why did my baby have such challenges feeding are autism related, or sensory challenges showing up early in life, because one of the most sensory filled experiences you can have as a child, like any of us, one of the things that uses most of our senses is feeding. We taste, we smell food, we feel it, the texture. Um, that has sometimes just various senses, hot, cold, various senses are used. And so it can be a sensorily overwhelming experience, and that can contribute to feeling challenges. And then things like challenges with eye contact, not having that smile. A baby, once they're like 2 or 3 months old, should be having this social smile. You smile, they smile back. You smile, they smile back. What if it's not happening? Now, what if it's not happening? What's going on? And so there's clues out there. There's clues. There's also websites out there. One example is ASD Detect. It's an app that you can look at different ages with your child and say, are they developing like it shows on the app? Is it like within the normal range or is it not? And if it's not, often, especially in New Jersey, by the time you get that diagnosis of autism and then the services that follow, it's years later. The waiting lists are long. It takes a long time to see somebody who's well versed in the subject, unless they go see you, of course, Dr. Vlad, in which case they can be seen right away. It's wonderful. Everybody knows about you. And if they don't, the waiting lists can be a long time. And by the time you get a diagnosis, a lot of time can last. And as a family member, as a mom or a dad or a family member who's concerned about your child, why wait until you have a diagnosis? Why not start doing treatment early?
And when you mention diagnosis and treatment, do you feel what specifically is do you mean by starting to take steps early on? Can you elaborate on that before a child is diagnosed?
Of course. I think that those early on in life, babies, even after they're born, they're developing so many neural connections, so many brain cells are forming, and the brain is wiring itself. I believe that you can take someone who is genetically predisposed to developing autism, because I think genes have something to do with it too. And you can change the phenotype through early intervention. So there are
What do you
specific
mean by phenotype? Can you let our listeners
phenotype.
know?
So there's a difference between genotype, right? So our disease, our conditions. I think autism is a gift, but I won't call it a disease. I'd say there's a lot of gift within it. But these medical uh, conditions show up with due to, usually there's a confluence of environmental factors as well as genetic factors, and to that contribute to the development of certain characteristics or certain behaviors. And with um, someone who's at increased risk, whose environment puts them at increased risk of developing autism, who's has genetic predisposition for it, you have those risks, but those risks themselves don't necessarily mean that the behavior is going to show up like someone with autism. Kind of like if you have a tennis player who's like 4'11", has no genetic predisposition to tennis, and yet they try really hard and they work on it every day and they focus and they figure out how to hit the ball and they spend a lot more time. They're going to eventually be good as tennis players. They'll be able to compete. Why? Because of effort, because of the brain rewiring itself, despite the genetic predisposition of being a great tennis player not being there. And so when it comes to autism, while the brain is developing itself, you can contribute to the nerves that are connected within the brain to the neurons and the connections and the synapses that are there. You can modulate that for your child through some of the therapy and some of the behavior that you do.
Can you give us an idea of what type of work that you do with the early start Denver model?
Yeah, of course.
How that looks like to families? Like, what would a family who is getting that type of therapy get that? And under what umbrella does that fall of in terms of therapies?
Of course, great. So I'm trained in the early start Denver model, and I'm trained in, or I've learned to now apply it to babies who are like 6, 7, 8, 9 months old. And um, there's different kinds of therapy in the autism realm. On the one hand, on one spectrum over here, you have ABA, applied behavioral analysis. The child participates in the behavior because they want something, and the behavior is reinforced if the action that they take gives them that behavior. That's ABA. And then on the other hand, you have something like playtime or floor time. And playtime or floor time is this opportunity to play with the child, to engage with them, to have fun with them in play. And that's playtime is great for like social connection. Playtime, I think, is great for improving some of the hormonal levels in babies with or children with autism, because sometimes playtime allows more body contact, for instance, and that increases oxytocin levels in our bodies, increases certain levels.
Cuddling hormone.
Yeah, the cuddling hormone helps with it. And when you have the cuddling hormone that's higher, it's also a pro-social hormone. So children or anyone with more of oxytocin in their bodies, they have this feeling that they want to be more connected. And
So, so as a parent, if I have a child on the spectrum, I should just play with them, and that would be a therapy for their autism. There's no professional type of play or professional approach to play that comes in where they can do also some learning along with that play.
yes, absolutely. So there's a combination. So we have lovely play, and it's wonderful and grows with the hormones. And we have the applied behavioral analysis, and then we have that in between. And that in between winds up being your early start Denver model, which there are early start Denver model therapists all over the country. There's training available both for parents as well as for medical professionals, if any medical professionals are listening, to get up to speed with that. And it's like this beautiful combination of these two different types of styles of therapy.
And when it's done right, what kind of results do people see? Like, how do we differentiate? Because one of the concerns that some parents may have is whether they've heard about previous forms of ABA therapy where it was more rigid, that children would learn certain skills and they would only be applicable in one situation. They wouldn't generalize them as much. When we combine the two, have a more flexible approach to kids and more playtime, what kind of results do parents see from that?
So the research is very promising with early start Denver model. Improvement in social behaviors, right? Because you're touching on all that social fun stuff. And improvement in some of them with IQ scores, if they do IQ testing with intellectual abilities, and improvement in language skills. So communication, which can sometimes be one of the hallmarks of autism, challenges in communication. Improved eye contact. So touches on many different aspects of the condition, and how to help these children to speed up their development.
And at what age is the an ideal time to begin this, or is there a point at which, past which it doesn't give children benefit if we started it at a certain after a certain age?
I I I'm a big advocate of starting with therapy young, doing as much as you can. If you have a concern with your baby, early start ever model when it's given to babies like 9 months old, and so it's called it has another term to it called the infant September model. And I'm a big proponent of doing that, not just necessarily even in children who don't have who have the traits that we start to get concerned. Is there something that will be diagnosed later on? But also in children in general, because it can't hurt.
So no
And
side effects to playing with babies, you're saying?
yeah, yes. If and but it also includes the ABA, but includes this in a way that isn't so ABA driven, where you lose some of that human touch and some of the human connection.
Okay. Okay. You mentioned the discussion that we often see in communities, on Facebook groups, in person is like um people use a lot of terms like uh is autism a disease? Is autism a disorder? Is autism an identity? You briefly talked about your thought on it. I want to hear a little. And I've mentioned on our show in a previous episode. On my view of it is that in reality it's like the duality of the human nature is that we are both particles and waves at the same time. So autism has components to it that are both a blessing and a disability at the same time. You can have two thoughts at once and it still be the reality of the story. It's not only looking at it from one standpoint. I just wonder how you feel about that.
I Yes, absolutely. We're talking about the amazing human connection, and I think that autism has and has had some survival advantages. So most of us who are who are not on the spectrum, and I think we all are to certain degrees, but who who are kind of like if there's a bell curve, they're kind of on the, and this is like normal, and this is more on the autism side. This is not.
What they call neurotypical individuals,
Yes, but we're not
even though we're
all of
not
us have
typical at
traits.
all.
All of
Neurotypicals
us
are all have their own traits and qualities and unique.
do. We do.
Yeah.
But the more neurotypical this you get, the more likely so much of your life is focused on human connection.
Hmm.
And what does the group want? And what are the group dynamics? And how do I fit within the group? Because that was a survival advantage, right? When we were cavemen and cavewomen, you had to fit into the group. You can be ostracized outside of the group. Your life depended upon it. You had to stay within the group norms, right?
Hmm.
But what happens when you're so focused on others and so group focused? You lose track of innovation. You lose track of ideas. You lose track of different ways of thinking. And in changing world, in changing times, different ways of perceiving the world are important.
Yeah,
Mhm.
we just look at Albert Einstein and Temple Grandin and Elon Musk and all the things that they've contributed to our society. Our world would look very different if we didn't have the perspective of those with autism contributing their ideas and their unique perspectives. You're absolutely right about that.
Yeah. Um, I think a lot of the people in New Jersey and New York who are being currently diagnosed with autism are on the higher side of things, on the
Hmm.
higher spectrum. And I think they will go on to live pretty fulfilling lives and with a different thought pattern, which is such a benefit to society. And there are also those who also have lower IQs or test as having lower IQs and happen to have autism. And they are a blessing as well. And the blessing comes from being able to give us gratitude in the day to day.
Hmm.
Because if you're the caretaker, your life's different than it was before. And those moments of caretaking teach you to have gratitude in simple things.
Absolutely. And, one thing that I have seen and heard from a lot of people much wiser than myself is that at the end of the day, it's no matter what we accomplish in life or how hard we work, it's that act of gratitude that leads to our happiness. You can have everything in the world if you're not like grateful for it or thankful for it,
Yeah,
you don't enjoy life as much.
yeah,
And if you have even what others would consider very meager, small amounts of what others would find blessings, which is it's a subjective thing, you can enjoy life tremendously starting right now. It really is up to you to determine what's valuable to you and appreciate things that you already have. To want what
yeah.
you've already got rather than wanting what you would like to have.
Yes, exactly. And an example of that is it's given to many of us that people feed and they eat, and it doesn't take too long, and they just grow. But a child with autism might have some challenges there with feeding.
Mhm.
And the gratitude that's developed when they start to eat, when they start to get better with their feeding, the gratitude towards you being able to, but to be able to regulate your own feeding and to have food and to have availability and to have resources. Like these are simple things that we don't even think about, but when our child struggles with them, um, when we see the growth that is happening as we engage in therapy to help them, um, there's this joy, and it's not joy that requires anything materialistic. It's joy in the growth of watching somebody else's growth.
You are a direct primary care DPC physician. How do you feel about a holistic approach to helping people with their health, or what does holistic approach to healthcare mean to you?
Oh gosh, I think it's important to stay open minded and to meet people where they are, right? So um, I have a family that comes to see me, and their child has autism, for instance, and they're just struggling with like, I want to have more engagement with my child. How do I do that? And I can't afford 30, 40 hours of therapy a week. I just can't, right? And so holistic care for me means meeting them where they're at, giving them resources to be able to do some of this on their own, and giving them step by step guidelines. And um, I think that encompasses many conditions. You know,
Mhm.
diabetes, pre-diabetes, same thing. If someone's eating junk food all the day, you're not going to get them to eat just salads and follow the plate diet perfectly on day 2. What are the small changes you can have? What's the healthiest thing you can get at the fast food restaurant? Let's start there. Let's make those changes. So, because habits aren't formed, are hard to break. And the habits are easier to break if either there's incredible pain that results from the habits, so much easier to stop them, or if they change slowly. It's similar to autism therapy. You start as soon as you have an inkling, you get worried, and the changes are slow. And you hope that the therapy you're doing will make a difference. And you don't know when you're in the middle of it. It can be arduous. It can be hard. And you have no clue what the end result will be because it might not work right. Not some children who are diagnosed eventually are undiagnosed. Maybe they
Mhm.
still continue with a condition like ADD or ADHD, but the autism part goes away, and others don't. Many don't. Some learn to speak with the behavior, with some of the therapy that you use with ESDM, which are like, I know how to do that to help children speak. and to improve their language skills. For some, after you start the therapy, it comes weeks later. For others, it takes years. You don't know. And so it's arduous. But the potential is there, and the hope is there, and the belief is there. And there's so much joy in following that growth.
So, do you find that the parents that have that growth mindset, that celebrate the small wins, they get to see and enjoy the process more by having a growth mindset?
I hope so. I hope so. Um, having a child with a diagnosis of autism can be devastating to the family.
Hmm.
Um, People who are more likely to divorce anyway at some point in their marriages are more likely to divorce.
Yeah, I saw a statistic on that. It was like, although the general population, like 50% of marriages, roughly 50% of marriages end in divorce, when you have a child with autism, the number goes up to 80%. Like it's striking.
Yeah, yeah,
Yeah.
incredibly. People grieve differently, right? Some people grieve by being like, give me the facts. I want to work on it right away. Let me figure this out. Let me figure this out. We're not doing enough. Let's go everywhere. Let's do everything. And they go really into the problem and neglect of a lot of other things. And some people's response is denial initially, and everything's fine, and everything's okay. It's too hard for me. It's too much to bear right now. And often someone's more focused and one person's more a little bit more in denial, which is normal part of a grief reaction, but those things can be. And that can create challenges within the
Mhm.
relationship and where people stop appreciating each other. And the and yet that child needs you, and he needs to see a stable or functional family in it in some way. And um, if that's the case, if there originally was a family unit, um, and finding gratitude in little things and celebrating small wins can start to bring a little bit of appreciation back to other relationships and a little
Absolutely.
bit of joy.
Do you think that a diagnosis helps more often than it harms, or there is some potential to harm families when a child does receive the official diagnosis? I mean,
So I see a lot of pros in the diagnosis for a couple of reasons. First, a lot of insurance companies will not pay for therapy unless there's a diagnosis,
yep,
and therapy can cost so much money. So having that diagnosis helps the therapy and helps cover the costs. And then diagnosis can give a sense of relief to the person who's believed something for such a long time but isn't sure and probably just wants to know, right? Because we're all, like many of us, are seeking truth.
yep.
So,
So, Dr. Evka, is there anything that I should have asked you during our conversation today that I did not ask you that you think we should mention before we wrap up?
oh my goodness. So I have pages upon pages of notes on how you do early starter over model.
Talk to us. We're listening.
It's completely doable. And so I'm going to give you three tips, three tips. I'll do three. Why not three? Um, and I think that'll be it. And then find me, read the books, Jolie Dawson, and people like that. Go to the courses, find the therapist, and of course talk to you, one of the experts in the field, Dr. Vladimir. And so I'll only give you three tips as opposed to my pages. And so the first tip is um, mimicry and mirror neurons are important. You want If you'd like to improve the language skills of your child, mimic them. Follow the steps of language behavior. If they say ah, you say ah. If they say boo, you say boo. Um, See if they are able to mimic your expressions. And as they start to you mimic them, they may be more likely to mimic you. Once the mimicking starts to happen, the next step is you start to introduce words. So, boo, ba, ma, mama, baba. That's grandma in some languages. And so, putting words together, all of a sudden, you've created words for them. And then you show them the pictures. You show, yes, good job, great job. You have mama. So that's important. And so there's a stepwise developmental progression when it comes to learning languages. Also, it's important to look at the oral motor stuff, having that evaluated to make sure that the tongue can go in the right directions, that the mouth can make certain movements for the sounds is important too. And there's specialists who do that, oral and motor therapists, some speaking specialists as well. So that's number one, to help with language. Number two, I think it's important for every child to have a secure relationship with their parent figure, because regardless of any conditions or diagnoses, wherever, every child deserves to have a secure relationship. And secure relationships are built upon responsiveness. Be responsive to your child. Follow their cues. Pay attention. Focus. Make them feel heard over and over and over again. And the third is play. And in that play, increase hormone levels. So increase things like oxytocin, do tickle fights, chase each other around the room, create positive emotions around interaction with you. Much more positive than just interactions among a toy. Because you're doing things together. All of a sudden, you become fun. If there's a toy they're playing with, put it around your eyes. Then go peekaboo with the toy. Peekaboo. Make yourself interesting to the child. That's going to help. So those are my three. I have so many more, but I promised three.
Wow, that was incredible. That was a master class. That was a lot of excellent tips and information. I thank you so much for that.
Yeah.
So where is the best place for our audience to find you? All those listeners we have in New Jersey that are looking for someone caring and compassionate, where can they find you?
Thank you. I do house calls, and evkamd.com.
We'll make sure to post those links in our show note, as well as the resource that you mentioned before, the ASD Detect.
Yes.
We'll have a link to that.
Early syndrome model and the therapist.
All of that in there in the show notes. Thank you so much, Dr. Evka. It was enlightening, heartening, heartwarming. The light in me, season appreciates the light in you. This was such an amazing opportunity to speak with you. I thank you so much for your time.
I'm so grateful for you. Thank you for everything you've done. And just with some of the challenges you faced, look at how you've turned those into these incredible opportunities to be this beacon of light and this beacon of hope within the world and within the Staten Island area. Thank you for all you do.
Well, I thank you so much for that. So as always, parents living in the New York State area, navigate autism with confidence. If you're looking for an autism expert to work with you and your child, please contact my office at 917-819-5056. And my team will be happy to set you up with a consultation appointment with me. Thank you, everyone, and have a beautiful day. Bye-bye.